Welcome to Pathology News TV from Sandwell and West Birmingham Hospitals NHS Trust, from the heart of the West Midlands, United Kingdom. Today we focus on the Clinical Biochemistry Department's work on legal highs.
Here we are on the Dudley Road outside City Hospital, close to the centre of Birmingham. Legal highs, what are they? They're powders, they're pills, and they're dried plant materials onto which chemicals have been added. Let's concentrate on one, the plant-like materials. This came in a few weeks ago with an unconscious patient. It contains something that looks like mixed herbs, it doesn't smell very nice, and it's got sprayed onto it a number of chemicals, including AKB48. Okay, Saturday morning, we've had a delivery of a white Jiffy Bag brought by the postman, first class post, recorded delivery, MPA and ethyl phenidate, AKB48, 5FPB22, and one that we haven't come across and haven't got on our analyzer, FUB-PB22. Let's look at AKB48 in more detail. It comes double wrapped in an outer plastic heat sealed bag. Inside there's two zip-locked bags and they contain an off-white chemical.
Here we have some plant material which came in with an unconscious patient. We are now going to see how the toxicology laboratory helps in the clinical problems caused by these substances.
What LCQTOF is liquid chromatography mass spectrometry time of flight. It's a hybrid machine, and essentially you can think of it as an incredibly accurate pair of scales. The library contains now over 100 legal highs. Our turnaround time is typically, for an urgent sample, we try and get preliminary results out within a couple of hours. If you just want to check for the standard drugs of abuse, then you request a drugs of abuse screen. But you have to appreciate if patients haven't took a drugs of abuse, for example, you're querying overdose of an antipsychotic, then the time of flight, the TOF screen, is the best request for that.
This is an LCMS Analyzer for drugs of abuse analysis. We're looking at a panel of 25 drugs, which are drugs and their metabolites, and some of the new legal high drugs that are being used in the UK. Approximately 80 to 100 samples a day are run through this type of analyzer. We get samples for legal highs from all over the UK. I'm looking at a legal high here which is called ethyl phenidate. This is my list of samples. This is what I'm looking for. I can see an internal standard here and a quantifier and a qualifier, which shows me two nice peaks and a guaranteed peak of my internal standard, and that's a nice peak to show that I've got an ethyl phenidate in the sample.
You can get further details of our drugs of abuse service and our LCQTOF screen from our website. We do hope that you have enjoyed this edition of our Sandwell Pathology TV News.
Welcome to Pathology News TV.
We look forward to seeing you next time. Bye for now.
That's got to go in. Do you have a clue what you're doing here? Do you know anything about this? No. That's a good question.
So often it can be quite a surprise when you put it for the time of flight.